Hey everybody, it's Valerie S of Nutrition Connection Balance, and I'm going to be talking to you today about clinic hints as well as procedures at NCB. If you don't know me, I'm Valerie S, the owner. I have had my private practice here, Nutrition Connection Balance, since 2005, and this is Kent Sayer, who's the head of 3 of the clinics. Our in-person staff at our Florida location is Heidi Sayer, office manager, and Ryan Borden, the shipping director. And then remote, we have wonderful Angie Benedetto, Maria Candati, and Dylan Early. We're going to talk about clinics, compliance, and retesting, and clinic ordering and test results. So ordering options are through calling NCB or going to our website under shop. When you do that through PayPal, make sure you answer the questions and sign the HIPAA. And then you can also email us to request clinic retesting if you've already been at our clinic. NCB team at nutritionconnectionbalance.com. Procedure is once you get your kits, you want to send in your samples. As soon as you receive the kits, there is a deadline date for each clinic. There are only exceptions when there's a medical reason or if I ask you to delay a kit. Once you sign up for the clinic, it has to be used for that clinic. On our website under education and the date, it has all the information about each clinic, what it provides, what it tests, all of those types of things, as well as directions and information. On the info sheet that is emailed to you if you've already been a current patient and you've called or emailed us to send you kits. The results are received on the date of the clinic or sometimes earlier. Sometimes when we have really big clinics, Angie, our clinic director, will send it earlier if we've evaluated it on time. And then it's always by email. You'll receive your individualized test results, the clinical overview, your specific therapy recommendations or changes, handouts, video, and one call or email reminder that it's been sent to you and that you received it. We do not follow up more than that. So make sure you put on your calendar to look for the email on the clinic date. When you are ordering supplements or therapies, you can do it by phone or email. Again, 850-227-7931 or ncbteam at nutritionconnectionbalance.com. You need to give the exact name and number of bottles needed. You can copy the names of the exact supplements from your individualized supplement list. You can't just say B12 because we might have many forms. You order and take all supplements through all the way until you receive your next test results, or even plan for 1 to 2 weeks after the results, because you have to have time to review them. You have to have time to order them. We have to have time to ship them. And so not when you send the samples in. You don't want to be without them. Part of the whole reason you're paying money is to have changes in your health, prevention, or medical treatment. You want to review your NCB supplement therapy list so that you know how many capsules, tablets, scoops are in a bottle. And you want to it's always attached with your clinic results at the bottom of the email. We recommend you take a picture and put it on your phone. We recommend that you print it out. You can print it out and put it on the inside of your cabinet, so look at it every time. I have a stellar memory, but I still look at mine every single time to make sure I'm putting it in my pill cases properly. Prices are always subject to change, and we have an NCB price list, testing clinic list, and supplements. And they're always subject to change because companies change, prices change. We try to update it at least 4 times a year or more. We actually updated it 3 times in January. So, you know, that it's updated. That will help you know what prices, how many are in a bottle, even if you're not sure what it's for, even though on your individual therapy sheet, it will say that. So you want to print out your therapy list, write how many in each bottle. You can do that even next to your therapy list if you don't want to look it up and you don't have the bottle there. We cannot be responsible for figuring out how many bottles you should order. You do the math. Of course, if you need help with one thing or something, or you're brand new, we'll do that, but we will not do that after that. It's not reasonable. Sometimes it takes hours. And if you put the order in, it cannot always be shipped that day. And you have to let us know. Many of you have multiple addresses. What address to go to? Is your credit card updated? So please be patient. All right. And then make sure you organize and be very compliant. You want to organize. These are lockables. You can get there for, they're called craft mates. You can get them at Hobby Lobby. Amazon, Michael's, that type of place. I love them. They have different sizes, and you can put breakfast, lunch, or AM, lunch, PM, dinner, bedtime, whatever you need. And they have a lock mechanism, so you can open one at a time and they don't fall out in purses and in travel. You can certainly use little baggies, and then you can write also. I do all of these things that I teach, have taught my family and patients. I also write on the bottle how much you're supposed to use. Let's say if it's capsule, you'd say 1 a.m., 1 p.m. That way, even when you do your pill boxes, you do them accurately, but always get out your sheet. If it changes, cross it out if you're not done with it, and then make sure you have your new sheet printed. Okay. And I know there's a lot of different ways to organize. These are just ways that I've proven to be very helpful, because people always tell me they're compliant, and then we look how much they've ordered and they've taken it 50 or 60% of the time. And that's why they don't have results. Okay, so be as compliant and organized as you can. We also are offering some new individualized packets. We're just starting to do this. It's taken us many months, and we cannot do everything. So if you're on multiple different therapies, probably can't, or if we have a particular thing we're treating, like there was just someone with a medical issue that we did a particular individualized box just for their arthritis, then they come in AM, PM, or an extra packet or a bedtime, and they come in each individual, and they're already doled out for you. So that is an option for some of you. We can't do liquids, we can't do SAMe, we can't do powders. So again, it doesn't fit everybody, but there are some ways that we can help. Or if you're looking for a family member that just wants a basic packet for a particular thing, then we can design that for them. And then that's shipped to you in 30-day supplies, or we can also have it reoccurring. All right. And then we have many different tests at NCB. We have things for nutritional status, heart, glucose, inflammation, toxins, genetic tests. Remember, genetic tests you only have to do once ever. They're invaluable, in my opinion. I go back to patients that have done genetic tests over and over, especially as I've worked with some of them for 25 or 30 years, to see what might be changing with age. And it helps me change not just their therapies, but even recommend, if they don't want to do a medication or they need one or something over the counter, what might be best based on their genetic profile. We have one for breast cancer and therapies, aging and inflammation, slim for metabolism, nutrient for different vitamins and minerals, and even CBD. So if you do use CBD, are you a good responder? Are you a fast metabolizer? Could you have psychosis with it? So very helpful. We have neurotransmitters that, in my opinion, should be our most popular clinic because of mental health, inflammation, sleep, post-COVID, energy issues, ADD, ADHD, Parkinson's disease, Alzheimer's. So helpful for so many conditions. Seizures, my athletes with glutamine, GI issues, invaluable test. Incredibly reasonable price for 26 neurotransmitters and the information you get. We have blood spot, thyroid, essential elite, and then of course an iodine by urine that is essential for anybody that has had breast cancer, is concerned about any kind of contamination or toxins or thyroid issues. Of course, I specialize in hormones, female, male hormones, adrenals, vitamin D, sex hormone, globulin binding, PSA levels, and so many more. They're all on our website. We have information sheets, and everything, like I said, is on the website that you can look if you want more information. All right, so then we also want to make sure that we're always bringing in new advanced tests, or some new advanced tests we brought in this year, because our patient load is getting older and older and we want to stay healthy. And a lot of times when we're looking at blood sugar, metabolic syndrome, and heart health, we have to do very advanced testing to really get down to the bottom of it, to help someone stay healthy, especially when they're trying to do it through diet supplementation and they don't want to take medication. So we have a lot of new and very advanced tests that are really helpful. So remember, it takes time, patience, and you must retest. The keys to success are be willing to make a change in your habits, your nutrition, stress, exercise, water intake, therapy changes, individualize, and retesting appropriately. Quality is the other issue. So many of you are getting supplements from other places, and that's why you're not having good test results. You have to ask a clinician how many patients they've seen, what tests did they use. I have over 500 companies in my office. I am not for one company. I'm for what works, how it's manufactured, as well as quality control. If it doesn't have the NSF certification, I know that has a quantification certificate. I've seen it work with over 20,000 patients. I have way more than 20,000 now. I just don't even know, quit counting anymore, as well as what is effective. And so again, we do quality control. It also helps me look at what you're buying to see what percentage you are compliant. So again, if you're not having results and buying it somewhere else, that's probably the reason, and we're not responsible. Often disease is not felt until a health crisis occurs. So we're really looking at prevention as well as treatment. And aging changes needs. I test my blood every year. Every year the doctor says, "Why are you here?" Because I don't take medications. I am on none. And I say I still want to make sure in case I do have an accident, if I do need a surgery, if I do have strep throat, I'm going to need a doctor. So you've got to realize that it's important that aging changes things. You want to make sure with your next clinic, put it on your phone, on your calendar. You will get one reminder only, and that's it, because you want to be paying attention to your health. And Angie really tries hard to call and email. Register and pay 5 to 6 weeks before the clinic date so you can get your samples in time and we have the results in time to evaluate everything. Everything is evaluated clinically, individually. Nothing is just thrown in there. So you can call, you can email, your friends, family, colleagues can register for testing clinics under our website under shop. Go to nutritionconnectionbalance.com. I hope you will go to our Instagram. Our Instagram is NCB Health, and we're doing more really short snippets. We've done 3 on vitamin D, we've done 3 on hormones, and we have done multiple ones also now on other topics, weight loss, fasting, that type of thing. So I hope that you will continue to stay healthy. We so appreciate you, but please remember these things and watch the video over again. Our website has a lot of information also. All right, our NCB staff and I are so grateful for you. We adore you and your families, and we want to just continue to make things easy, have great results, and great compliance. All right, take care, everybody.